Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health.
Hey, this is Doc Yates, and welcome to the Simply Health Podcast. We're going to continue our dive today into fertility treatments, natural fertility treatments. So again, if this is not something that you are personally struggling with, chances are you know someone that is, and please share this podcast with them. And today we want to talk about 6 key, critical, important factors that can play a role with PCOS and fertility and how you deal with this naturally. So 6 natural treatment strategies you want to consider when dealing with PCOS and improving your fertility. Because typically speaking in mainstream, what you're going to get is you're usually going to be given metformin, which is a diabetes medication, and sometimes you'll be giving the stronger medications called aromatase inhibitors, which kind of help block your hormones. And while it is important to balance the hormones, I found that using these natural treatment methods are a lot safer and I would say more effective from what I've seen in practice. So number one thing that we want to talk about, and it's almost the foundation of most treatments you work with naturopathically, is your diet. You can take all the medications and supplements you want, but if you're literally just living off of a very high sugar, high processed diet and you're dealing with PCOS, it's not going to matter. You have to address the diet first. And the diet that works best in PCOS, in my experience, is a lower carb diet, which means you really want to do your best to cut out sugary foods, high processed white flours, and focus more, if you're going to do that, like whole grains, lots of high quality proteins, a lot of above ground vegetables. And I would even say more so than the whole grains, like you let your starches come more from root vegetables or some fruit sources instead, because at least you'll be getting some of the different vitamins and minerals that you're going to be wanting, we're going to discuss in this program. So really limiting, like I said, white flours, white breads, pastas, those things, and replacing those more with high protein, above ground vegetables, and doing it that way, that is the foundation of the treatment. So even if that was the only thing you did, that would be the most important thing for working with the PCOS and your fertility. The second one, which you're going to hear about a lot more online because you can sell it, and this is called inositol. Generally speaking, online, you're not going to see as much stuff always about proper diet techniques, for the reason being is that you can't sell diet. So they're going to talk about supplements, and this supplement has been shown to have benefit. So it's called inositol. Technically, it would be kind of labeled a form of like B vitamin, and this has been shown to help balance hormones and cycles in females with PCOS. In practice, I have found a lot of people with PCOS are already on this by the time they come to see me because they found this information online. But I've also found that to just use it on its own, the effect is not as great. So I think it's an important thing to be part of your toolkit and part of the treatment plan, but it is not like a standalone weapon that's going to fix this for you. So incorporate it in. What we've done with this is that we've kind of just built it in to one of our other products. So it's built into our B complex that we use, and that way we make sure that it's part of the program, but it's not a standalone by any stretch. The next thing is our herbal therapies. So herbal therapies they're going to form 2 purposes. Some of them are for direct for hormone balance, like to have a role with estrogen and progesterone, and this is where we use herbs like peony. Peony, especially they use this a lot for PCOS in Chinese medicine. So peony is always part of and I'm talking about the actual like plant, the flowers that you know, peony. So they use peony root in Chinese medicine, and I have found this to have great benefit. It's combined with Vitex, which is another herb. Also, you might have heard it is called chasteberry. So peony and chasteberry are part of the formula. The other thing is that then you start adding natural aromatase inhibitors. Sorry, I'll adjust my microphone there. Natural aromatase inhibitors. The biggest ones for these would be things like saw palmetto, which people often associate for men as a prostate herb. And then the other thing is nettle root. But these are natural aromatase inhibitors that can help in terms of balancing your hormones. And when combined with peony and vitex, it can help you see a whole balance of the hormone panel and see a great effect. So make sure that these are part of the program as well. The next one are minerals. Minerals play a big role in your hormone health as well. A big thing is zinc, selenium, iodine, and trace minerals. And don't go out and start buying all of these things individually, because there's just way too many pills to take. The goal of this thing is not to give you a shopping list where like here's 20 different things that you want to go take. But if you're going to take them, you want to use these in combinations. Like of everything I'm talking about, this could all be combined in 2 to 3 products. So you could have literally 2, maybe 3 supplements in a low-carb diet. Follow that and see the benefit doing it that way. You don't want to go out and buy like 10 different things to address this, because that would just be crazy. There's no way you're going to want to swallow 10 pills and open up your little pill case every day like a senior citizen. Oh, it's like, oh, here's Monday. I'm going to take my 10 pills in the morning and 10 pills at night. You don't want to get into that. So look for combinations that have all of these things in it. So again, for the minerals, zinc, iodine, trace minerals, we've put all together in something called super mineral, but you can find these multi-minerals at any health food store online. I'm not trying to say this just to promote our own stuff. Number 6, once you start getting things balanced, it's important to make sure that you're doing ovulation for fertility purposes. If this is the main goal, ovulation testing to find out and confirm when you're ovulating, because you should start noticing the cycle starts improving, and hormone testing. So check once you start getting a cycle that starts to become more regulated, checking your hormones and seeing how your progesterone is working in the second half of your cycle, checking with ovulation kits and testing for like mid-cycle that you're ovulating. This is all going to be important in terms of you getting pregnant. Now, keep in mind, there is definitely kind of like a textbook picture that a lot of people have when it comes to PCOS. And generally what this would be is that female, typically more overweight, lower activity levels. Sometimes you'll see signs of increased like androgen, which is like more facial hair growth, almost like a little bit of a like sideburn growing. And that's the textbook case. Sometimes it's almost like you'd look at like a pre-diabetic kind of case, and that's the textbook look. But the number of cases that I've seen come into my office that are the exact opposite of that, it's just happened so much that you don't just expect the fact that you're like, well, I don't fit any of those symptoms that they show online. The main thing is that if you have a period that is very irregular and a very irregular cycle, that's when you'd want to be wondering, is this PCOS? You can't just say, well, I don't have problems with blood sugar, I don't have problems with my weight, I don't have problems with androgens or facial hair, therefore it's not PCOS. And don't let your doctor just kind of like check those boxes off and say it's not that. The number one thing is that if you have a cycle that is very irregular, like let's say you only get your cycle every like 2 or 3 months, get that checked out. Don't put that off, because you could start into these treatments earlier rather than later and have a benefit faster. So this is just to shed a little bit of light on the natural treatments for PCOS that I've seen in practice and that I've used in practice and seen have good benefit, and I wanted to share that with you today. So I hope this was helpful. This is Doc Yates signing off.
Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.